So welcome everyone, and thank you all for joining us this afternoon. I'm Susan Stern. I'm the coordinator of the Children and Their Families field of study, and I'm looking forward to our presentations and our conversation with our distinguished presenters today, Andréanne Deschamps and Tracy Gross. Today's moderators will be our colleagues, Dr. Bryn King, a faculty member in Children and Their Families field of study, and Krista Cook, a current student in Children and Their Families. So thank you all for being here. We'll begin today with 15 to 20 minutes from each presenter, and then there will be an open conversation and opportunities for you to ask questions and engage with our speakers and our moderators. Today's presentations and conversation is being recorded, and it will be posted on the Factor-Inwentash Faculty of Social Work website and our YouTube channel. So during the questions and answers, you can either enter your questions in a chat or you can raise hands, but be aware that if you raise hand, you will be on screen and be on a recording, so that will be giving your consent. The chat is open for you to enter questions during the presentations, but we will wait until after them to begin the moderated discussion. Okay, so let's begin today. Thank you all for being here and for joining us. Okay, Andréanne?
Yes, thank you, Susan. Hello, everyone. My name is Andréanne Deschamps. I'm the Associate Vice President of Service Programs at Kids Health Phone. I am responsible for overseeing the quality of our services to make sure that young people are getting the best services as possible. I also oversee our Indigenous and equity programs, providing us with the opportunity to work with communities. And I also oversee our mobilization programs, which allows us to make sure that young people have access to the resources in their community and doing some community building as well. I'm thrilled to be here today and having the opportunity to share about Kids Health Phone services, but also our learnings from speaking with young people every day from coast to coast to coast. I would like to begin by acknowledging that the land on which I am is the traditional and unceded territory of the Mohawk and Abenaki people. Next slide. Kids Health Phone has been providing support for 32 years now. We started in 1989 as a single phone service, a confidential and anonymous place where young people could connect with a counselor for any crisis or any situation that they were facing. Obviously, we've changed a lot over the years and evolved to not only keep up with technology, but also the ever-changing needs of young people. Our virtual care is rooted in changing lives, but also supporting the families and the communities in which we are. Currently, we are still the only national bilingual 24/7 resource for young people as they define themselves, and we still offer confidential counseling, crisis support texting, information, and referrals to communities. Next slide, please. 4.2 million interactions last year. It probably comes to no surprise to hear that 2020 was a very difficult year for many people. We saw a significant increase in number of young people reaching out for support. Not only did we hear how difficult and a challenging time 2020 was through the stories that young people shared with us, but we also saw it in the number of times they reached out to us. To put that into context for you, in 2019, we had 1.9 interactions. That means that in 2020, we doubled that number of interactions, mainly brought on by the pandemic that we faced. So for information, out of the 4.2 million interactions we had with young people, those are the number of times we had phone conversations providing counseling support with them, or we had crisis texting conversations, or even young people engaging on our website to find the types of resources, either information, but also even resources in their communities that they could access to seek help. Next slide, please. The data that I'm showing you right now comes from our Insights page on kidshelpphone.ca. Insights provides us a window into the learnings we have for young people. And it also allows us to share with them that they are not alone. So the data that you're seeing today, if you go on Insights, you will see the updated monthly information around what are young people telling us? What are their main struggles? How many times are they reaching out for help? So one of the things that we see is that young people have been reaching out to us through text more than they have over phone. We also see that the majority of young people reaching out to us are between the ages of 14 and 24. We also know that during those years, it is also where a lot of young people face many, many transitions. And so we're able to leverage our data and what young people are telling us to be close to what it is that they're facing and making sure that our services continue to be responsive to what they're telling us, but also even some emerging trends that we will see. Next slide. Okay. This is also information that comes from our Insights on our website. What we see is that mental and emotional well-being, relationships, and suicide are the main areas of concern for young people. Those main areas of concerns have remained consistent over the years. So the numbers may be different, but they are always the same. Young people reach out because they worry or they have questions around their mental health. They face struggles in their relationships. They are thinking or they're worried about someone who's thinking about suicide. And they keep coming to Kids Help Phone to talk through these issues with us. We also know, knowing that these are some of the most sought after types of conversation, it helps us make sure that the resources we have on our website are tailored to the most often discussed topics. Excuse me. Okay, knowing that young people are using technology more than ever, and knowing that these are the types of information that they're searching for and they're wanting help on, we're also leveraging our insights as to what they're talking to us about to make sure that the information we put on our website is evidence-based and reliable, so that young people, when they do want reliable information on topics, they have a safe place to go to. So you will see that on our website through, for example, information on anxiety and stress, excuse me, but also providing them with information or even tools such as our questionnaires around what are feelings of anxiety and stress and what do those look like. If I'm feeling anxious, but I'm not really sure what kind of words I can put on that, Kids Help Phone will have resources to help young people be able to share their story and put words into sometimes difficult feelings that they may be experiencing. Next slide. I'm sorry, I have something caught in my throat. Now, we know that young people talk to us about emotional and well-being, suicide, and relationships. We also saw in 2020 something unprecedented in the 4.2 million interactions we had with young people. We also saw that had an important shift in the types of issues that young people were talking to us about. So what you're seeing here is the average increase in conversations on certain topics. So what we saw through the pandemic is that young people reached out to us around eating and body image. Almost the number of times they reached out almost doubled. So they talk to us more than ever about disordered eatings and body image. Our contacts around grief significantly increased as well. Substance use, gender and sexual identity, isolation, abuse, and neglect. All of those really had really soared into the types of conversations we had with young people. We know that anxiety disorders often coexist with other disorders, such as eating, disordered eating. So it was not necessarily unexpected to see that if young people are feeling more stressed and anxious than ever, then that would come through some other types of difficulties they're facing, such as eating and body image. We also saw that texters with parents who are essential workers, frontline workers, they reported higher levels of stress than any other
Mm.
texters during the pandemic. So when we say that young people reached out about anxiety and stress more than ever, it is about for themselves, but also because young people were very afraid for their parents, for their family, for their friends. And that sense of isolation only increased because we were also um, within our own homes. We were isolated and not being able to connect in the ways that that we typically could, and that also very came through in the conversations we had with the young people. We heard about their grief, the loss of routine, being uprooted from having, you know, a set of schedules, going to work, going to school, and then all of a sudden, a lot of these things changed overnight. Young people lost their jobs, weren't sure if they were even going to be able to graduate. We heard all of those stories from young people. And that came with a lot of anxiety and fear. But what does that mean? I was supposed to go to college or university next year. Will I get there? Um, I was in a place where I was struggling in school. What's next for me? And the young people also relied on a lot of the services within their communities or even their school setting. And when we had a lot of school closures, young people were left with a lack of resources that were available to them. And so we saw the increase in our contacts because a lot of the ways in which young people had helped before suddenly became unavailable, whether permanently or temporarily. And young people turned to Kids Health Phone to be able to get in the moment support. So we had to be very nimble in the way that we provided and shift the supports that we offered to young people so that we were able to provide more information related to the concerns that were really soaring through the pandemic. Um, on also knowing that they had limited supports potentially outside of Kids Help Phone and within their communities. So we wanted to make sure that every time a young person connected with us, not only were we able to provide them with the help that they needed in the moment, but also allow them to leave with a plan that was also realistic to the new circumstances under we were all living, and that were all very, very new for all of us. Next slide, please. This is more information specific to COVID-19. So you will see if you follow the pink line that we had a huge surge in conversations around COVID-19 starting in March and peaking in April. And then they consistently lowered, but they still remain between anywhere between 7 to 11,000 conversations and young people reaching out related to the pandemic on any given month. So that is substantial. Young person, we're not necessarily reaching out to specifically talk about COVID, but it means that it came through the conversation that maybe it was the impact of COVID or the way that COVID changed some circumstances in their life. So it's not necessarily about the virus itself, but its impact on their lives and the way that young people were trying to cope with it. We also saw something very interesting, but not unexpected. We saw an increase in the number of text conversations we were having, and the number of calls decreased. And we attributed that to the fact that we were isolated, but we also had to stay in our own homes. And so young people also became challenged to finding areas where they could have a private conversation over phone. If a family, a 5 or 6 are living in a small apartment, privacy became an issue for many young people. And so we had to rely a lot on our texting service to be able to continue providing a high level and a responsive level of services. Something else that isn't in this slide, but while we were dealing with the pandemic and its impact on our lives, we also saw that on May 25th, George Floyd was murdered, and the number of people distressed and that called distressed related to racism and discrimination doubled after that date. We saw an increase in the number of conversations about racism and discrimination from 7% to 17%. That more than doubled after his murder, and also when we saw the social unrest and the Black Lives Matter movement. What we also learned from young people is that the texters who report racism as a cause of distress were among the most distressed of any texters, and only second to those who were fearing abuse in their own home. And that is the level of distress that they were sharing with us. Texters who reported racism as a cause of distress were also more likely to talk about suicide with us than any other texters. We also learned that young people who were refugees, who had no status, or newcomers were also more likely to experience grief and isolation. We learned through that young people needed us and needed services more than ever. And over the summer, Kids Health Phone embarked on a journey and actually made a very strong commitment to equity, inclusion, and diversity within our own organization, but also in the way that we are providing services to young people. We want to make sure that we are working with the communities and the young people who are facing racism and all kinds of inequities, and understanding how can we best support them in a way that is appropriate and culturally relevant to them. Next slide, please. So we know that when young people connect with us, and that's through all their different touch points, we see that we actually are able to reduce their distress. So even if young people are reporting having really, really high level of stress, what we see is that about 30% of them say that they are reducing their stress with just that one single interaction with us. 88% of texters feel better about after their conversation, and 98% would actually use the service again. So we provide our services through a single session framework. So we want one conversation to be, we want to be able to work with a young person through a one conversation type of model. They are obviously able to connect with us again should they need it, but we do not we don't provide follow-ups with the same person being a 24/7 agency. So knowing that we're able, within 20, 30, or 40 minutes, have that level of impact on a young person is not only reassuring, but it's also telling us that we're doing something right, and we need to learn from that to be able to do more. We also know that after texting, 82% of young people felt less alone, less distressed, upset, and actually more hopeful and in control, which tells us that we're working on helping young people understand their strengths and also help them build their resilience so that Kids Health Phone can be there when they need it, but they also feel more confident in being able to take that next step for them. We also know that 11% of young people probably would have gone to the emergency room or a healthcare provider had they not reached out to us. And many of them actually would have tried to manage it on their own. So it means that a lot of young people are reaching out and they're actually telling us things that they would not be telling others. So there is still that sense of stigma, or there is that space that we need to hold for young people to be able to express things that may be too hard to tell face-to-face to someone, or maybe it's too hard to tell someone that and it's easier to talk with a service such as ours, which is an important learning for us. Next slide. We also know that there's still a lot of barriers to receiving services. We've heard from young people that privacy was an issue, long wait time lists. Some services closed or had to suspend their services through the pandemic. There's still a lot of stigma. Sometimes young people feel like their problems aren't big enough. We don't believe that any problem is too big or small, but yet we still hear young people saying, I'm not sure I should be calling. I'm sure there's, other people who need more help than me. And we try to make sure that young people feel like whatever they are going through, it's as important and as anyone else's concern and worth our time and effort to have that conversation with them and see what kind of support we could be providing to them. Next slide. So understanding that there's still a lot of barriers for young people to access mental health supports. We are also seeing that there is a severity and a scale of the crisis that is just taking, that is just growing more and more and more. We were seeing the contacts increase year after year. 2020 was a record year, but even before that, young people were reaching out more and more. We were hearing from them about having difficulty accessing resources or even finding the appropriate resources. We also know that our contacts related to suicide have increased 100% over the last 5 years, pandemic aside. So the struggle is real and it is there. And knowing all of this information, it compelled us to act and build our innovation imperative, which I will quickly walk you through on the next slide. This vision is something that we're bringing to life right now, and it leverages technology, which is where young people are at right now. It leverages their voice, their ideas on relevant mental health support for young people to build a system of services that increases a young person's ability to determine the kind of resource that best meets their need, but also their current circumstances. And that is sort of the vision that we are working towards. Next slide. So this is called our innovation imperative. So as you will see, the way that we are structuring our service is through what would typically be called a stepped care lens. So we are looking at providing different types of supports to young people in a way that allows them to choose and to have flexibility around what kind of supports that they want to be accessing. So we're broadening our service model, which right now is our website, our texting, volunteer support, and professional counseling. And we're building that out to include moderated peer support, where young people can empower each other and learn from one another and relate to one another around the different issues they may be facing, or even get some feedback around some questions that they may have in a space that is safe and that is reserved for them. So we will see that on the lower end of the intensity, so the educational information, the self-directed tools, what we're building there is not only information on certain topics like what is anxiety, but we're also looking at providing information on, well, if you want to do some work by yourself and you're not ready to talk to an adult or another resource, what can I do as a young person by myself to maybe help me deal with the situation I'm facing? So we're building our self-directed tools where there's going to be interactive skill building resources, quizzes, activities. We have a journaling activity, things that young people can use by themselves to help them cope with the situation that they're facing. And therapeutic information, but also providing them with a space to also, once you've done some work, you may be in a place where you're feeling more confident about talking to someone about the issue. And how do we help you bridge that gap so that you can go towards resources in a way that you feel more confident about your next step in your journey? So our goal through that is really to be able to help young people build their resilience, but also do some prevention, and also allow them to choose really what they want and not trying to force them into, well, this is what you should be doing, but really about what is it that you want, what is, and making sure that they're autonomous in their journey to improve their well-being. Next slide. I will leave these quotes for you to read, but they are things that young people tell us every day. In regards to inclusivity and diversity, we know that young people are struggling, and we know that we have a long ways to go to making sure that every young person who is facing inequity has the ability to connect with resources that are culturally relevant and appropriate. So we have taken steps to deepen our reach and our commitment with the communities of vulnerable youth. One of the things that we have done is that we've launched our Indigenous action plan called Finding Hope. Um, and these actions are things that Kids Help Phone has committed to and that we're implementing with the leadership of Indigenous communities across Canada. We are at the very early onset of doing something very similar for Black young people and people of color as well. And our first step is to actually build our advisory council so that Kids Help Phone is not um, creating or changing any services without the direct input of young people who are in need of those services. And so those are some of the early commitments and early steps that we've been taking to make sure that we are looking at our services through a lens of not just every young person in Canada, but the specificities of the different young people in Canada. So on that note, changing the landscape of supports in youth mental health really takes an entire network, either of formal services or even informal support systems. We are all part of that system informally and formally, and as future social workers, you will be part of that formally as well. So we will be changing the landscape together, and we will be relying on each other's strengths to do that. We will obviously rely on you whether you're working in schools with young people, in institutions, etc. As much as you can rely on us on a 24/7 capacity, not only for resources, but also for young people if they're dealing with anything in the moment and whatever tools that they would use are not accessible, we are always there for them. We at Kids Help Phone believe that together we will be building a safety net in which mental health and well-being will be supported for every young person in Canada. Thank you.
Thank you. That was fascinating. Tracy, are you there? There you are. I couldn't find you.
Yes, good afternoon, and yes, welcome. I am, can you hear me well? Thumbs up. Yes, I'm Tracy Gross. I am a social worker, well, originally with the Durham District School Board, but now I am working for School Mental Health Ontario. So I hope I'm sharing the right version of my slides. I don't think I am. Hold on, let me try this again. Let me share this screen and see if that works better. No, it looks the same. Are you seeing my, oh no, I have to start my slideshow. That would help. There. Okay. So thank you for inviting me to the Children and Family Cafe and talking about supporting children and families, our response to the double pandemic. I just thought I'd give you a little history about myself first. I am a graduate of U of T, UTSC to be exact, but I also had the opportunity to do graduate study in the US. So my Master's of Social Work is actually from the University of Georgia. An interesting story, as we're talking about anti-Black racism in the double pandemic. University of Georgia was a school that when I went, was working under sort of an equity affirmative action plan. And the state school was under threat that if they did not admit and graduate students in the same demographic population as the state, then they would lose their state funding. The state had 13% people of African American ancestry, and the school was not admitting and graduating students. In fact, there was a law professor at the University of Georgia who promised that no student, racialized student, would ever get more than a C in his class. So I got to attend University of Georgia under that great change and shift and legacy. In fact, one of the main people, Charlene Hunter Galt and Hamilton Holmes, were two of the first students to desegregate the University of Georgia in 1963. They actually attended the university with police guard and NAACP protection. I had a wonderful time at the University of Georgia, and in my 2 years, learned a lot about social work, and actually went on to do a certification in school social work, which is something that is also a requirement in the US to work in schools. So when I came home, I was very uniquely qualified to enter in school social work. And I still brag, I don't know if it's something to brag about, that I was the first and only Black social worker in the Durham District Schools Board for probably 15 of my 18 years. So what is a school social worker? A school social worker is someone who values early intervention. I was telling the team before when we were planning this cafe that it's the best time to intervene on behalf of a student's mental health. It's a great access point and a triage to connect to community services. So I am very pleased to work as a school social worker. And what does it value? I think that, you know, the history is that students were first seen as absent or truant, and they used to have truancy officers go and look for them. But then there was a realization that social workers have a unique set of skills to look deeper as to what is the reason behind their absence, what is going on. And so now in the province, there's many more social workers doing truancy and social work services. We use a lot of theoretical frameworks such as clinical intervention, student in their environment, understanding the school and home community model, and then of course all the other evidence-based mental health services. So a school social worker functions with interacting with the school system, advocating for children, using anti-oppressive practices and advocacy. Unfortunately, we have to sometimes call child protection, but we can be that child's first mental health clinician. Let me move to the position where I am right now, which is with School Mental Health Ontario. School Mental Health Ontario is an intermediary body between the Ministry of Education and the school boards. And there's a strategy and a plan to help increase the understanding of students' mental health needs in Ontario public schools. And so every school board now, since the arrival of School Mental Health Ontario in 2013, now has a mental health leader. And there's a strategy on how to increase mental health literacy in educators, in their teachers, but also increase the access to mental health services for young people. So as it relates to COVID-19, there was a research recently done on over 2,000 Canadian students between ages of 9 and 16 to really just look at what is the impact of the pandemic. And so now we are looking at the fact that the researchers realized this sample was not ideal. It was only a cross section, but they did say that students who had access to movement were better off, that they, of course, increased their screen time, which was not perfect, and that subjectively their well-being was dependent on a number of factors. There was an increase in worry. Some of my data is very similar to what Andréanne is going to share, that the subjective feeling of empathy and well-being was depending on their access to additional services. I think this is where you saw that increase in the use of help seeking. I know there was not necessarily an increase in teenage suicide. There were challenges in accessing mental health services. There had to be a big pivot to move to virtual use of services. But that's not the whole story. So what we notice is that there's an intersection in the impact of it. And for example, students who had more access to outdoor facilities. If you lived in an apartment, if you couldn't get to a park or to go for a walk, or you lived in an urban area, there was less opportunity for well-being. Those students reported less connection to their peers. Depending on if they're in the hybrid or the in-school, of course, that lack of social contact was very concerning for young people. So intersection matters, because in this, there's a COVID story for everyone, and just really understanding how much more racialized communities felt the impact of are feeling the impact of the pandemic, because it's still in place. That families in their situation of where they live and the roles and the jobs that their families have exposed them more as frontline people to potentially contracting COVID-19. So this is very concerning, and it still needs to be examined, because as even the healthcare providers and the educators are collectively experiencing their own stress, and then we are trying to provide support to students in our communities, there's this cross section of, how much do you care for yourself? Where do we bring forward, the best practices? And then how do we strengthen the community in the way that we're going to deliver these supports? So I know School and Health Ontario has done a number of things to try to engage, like social media or the internet, and young people are the greatest advantage. So on our website, which I'll put in our chat when I stop sharing, there is a school mental health return to school kit and a mental health toolkit, action kit. There are breathing strategies, modules. We are providing information directly to teachers on how to teach well-being. There, of course, are those who are clinically significant and need to be involved with a third party or a community agency. But how much can we just raise the bar in terms of awareness about anxiety, mental health, that we all strive for mental health and well-being. So I hope you all get the chance to visit our website. Everything is both in English and French, because we are a provincial organization, but we're emphasizing self-care. We're spotlighting the fact that if we're caregivers, that we have to first practice self-care as we go forward in helping and improving the well-being of other young people. We also have a lot of social media bundles. So we have a website and Instagram called Thrive SMH. I can also put that in the chat, but we're trying to create graphics and images and teach those well-being strategies so that students can have access to these materials and even just teach themselves. And we are also doing a video series where students will now also see how to, in their class time, demonstrate square breathing, stretching. It's an interesting time. I know for me as a school social worker, I'm seeing that overall this could really move forward the awareness of mental health in our communities. And again, schools and young people getting that intervention early is a great start to a pathway to really a healthy lifestyle. So that is what I brought to share with you today. And I know we're going to move on to questions.
Thank you to both of you for those presentations. That was a lot of information, but it was definitely something that, like, speaking as a student, I know that there's a lot of things that you mentioned that, like, we've been talking about, especially as folks who are about to graduate and go into the field. So at this point, I think we can open it up to any questions that folks may have. As Professor Stern mentioned earlier, you can either just raise your hand, or you can be on video, or you can drop any questions into the chat that you may have right now.
You want to start with some of yours, Krista?
Sure. Yeah, I did have a question about the Kids Help Phone services. So you mentioned that the rise in calls relating to racism went from 7 to 17%. You've also mentioned that you have some other initiatives in progress for equity seeking and BIPOC communities, but can you speak maybe more about how call or text support approaches may have changed to respond to racism as opposed to other issues that you've maybe presenting?
Yes, of course. So there are some immediate and some long-term actions that we're taking. The immediate actions that we took was to make sure that we were providing more information for our frontline teams around this is what's happening in the world, and what are the best practices to make sure that we are supporting young people in the way that they need, but we're also asking the right questions, and that we're not assuming who the young people are while we're talking to them. Because we are not a face-to-face service, it's easy to assume or make assumptions as to who the young person we would be speaking to might be, and to project our idea on them. So really be at a place where we're actually asking questions like, what is going on? What are the struggles that you're facing, in your life, but also within your environment, so that we understand what are the barriers, but not just on an individual level, but are there any systemic barriers that young people are facing, that we need to understand for us to be able to provide the best services that we can for them. So we've been doing a lot of work with our teams to make sure that we're providing resources around being culturally relevant, culturally appropriate, anti-Black racism, and having a framework that is embedded in our frontline service. The longer term service is also looking at, we know that young Black people, for example, are using our service. They're about 5% of our total service users right now, which means our services resonate with them. But we still feel like that's not enough, because we're also not reaching every young person. So we're committed to learning and listening as our first step, and then understanding what do racialized communities need from Kids Help Phone that is currently not available and that they are not funding. So we have not committed to a specific action, because we don't feel like that's a commitment we can make without hearing what young people need from us. And we're also looking at, even the way that we ourselves are at Kids Help Phone, we've taken a pledge of diversity, of making sure that our frontline teams are also representative of the Canadian landscape in terms of diversity. So we're taking a lot of simultaneous steps together, and even just with challenging ourselves and making sure that within the organization, we are talking about inclusion and diversity, and that we are helping each other grow and learn from the different experiences and the wealth of experience we have from the young people, but within the organization as well.
Can I ask a follow-up question? So, and this is probably for both of you, but I was really struck by the level of distress that you reported, Andréanne, about young people who are calling in about experiences of discrimination and racism, and that their level of distress is comparable to young people reporting abuse. And so it really sort of underscores this point that we continue to try to raise around racism as a trauma. And how do how do our students think about engaging that content? And either of you can answer this, or both of you can answer this. I've never done kind of phone or text or helpline, so I like literally have no idea how you respond to a kid who's suicidal via text anyway. But like, how do you engage this really complex, deep, and potentially sort of self-organizing? This is like, these are questions and these are issues that are central to young people's identity, and they're so deep and they're so core. How do you do this in the context of schools, via text? It's just, yeah. And I think, especially right now, is super important.
Well, I too was really shocked to hear that data, Andréanne, and that it was recorded as data. And I really hope that that gets taken farther. Being a person, from the African Caribbean community, I know that, and I'm happy that some people are acknowledging, but some people don't acknowledge things until you have data. And so I know within schools and within the province, the Anti-Racism Directorate has provided school boards with funding to do race-based data, Toronto has done race-based data from a long time ago, and this is why they've been able to move on things like this, the Black Student Success Branch, which is a whole branch of success initiatives to target the gap in student achievement. And so to take race-based statistics, which the US has been doing for decades, allowed them, well, that's what allowed me to attend the University of Georgia. When we don't take that analysis, then we are caught in still, well, really, is there a disparity? I don't know, it sort of feels like it, maybe. No, here are the numbers. And so with the numbers now, we can make recommendations and specific programming as it relates to research, hiring people, and designing programs specifically to address the gap and stop pretending that things don't exist. So I was shocked to hear it, but glad that there's that data, so we can do something like that. And even the position that I've been hired in School Mental Health Ontario was recently created as in response to George Floyd and the realization in the world that there are disparities. So we still have a lot of work to do.
True, and from a helpline perspective, because the way that, so our services are really geared towards single session framework. So when a young person is dealing with trauma, and this is where the stepped care model really helps well, is that young people can interact with our services in different ways. So, you know, the help we want to provide in a single session, we also understand that that work continues. So healing is a journey. And what is Kids Help Phone's role within that journey? And we understand that young people may use us at the beginning, at the middle, at the end, or all throughout that journey. But we always look at it from a lens of, so how are you feeling today? And understanding that, you know, you are healing through that. What can we do in this instant that will help you move further along? And understanding that we will not, you know, we don't expect or we don't pretend that after a 45-minute conversation with a counselor, you will have healed. That is not our expectation, or would it ever be? It would be presumptuous of us to think that. However, we have a role that we can play to support a young person's healing, and we make sure that that is defined by them. So asking really important questions around, like, is there anything that I haven't asked you that you feel like you would like to tell, or that you want me to know about you, that would help me understand what you're going through? And allowing that space for young people to share those stories, or to tell us what's in their backpack, what are they carrying with them when they're calling in and wanting support on an issue. Because more often than not, they will call and potentially talk about the presenting symptom. But then when we have that conversation and open up around, but what is going on with you? And I'm interested to know about you, then we hear the compounding factors, or we hear the root causes. And then we're able to help the young person say, well, what's then your next step? And what does that look like? And what are you actually comfortable taking? And that's where we see our role being. And sometimes if the young person's level of distress is at a 9, maybe after a conversation, we want to bring it down comfortably to a 7. And that would be okay with the young person. And that's how we gauge the impact that we have with a young person. And that is our approach to make sure that we're not putting undue stress and pressure on ourselves and on the young person to meet a goal that is too big for a single conversation. But knowing that we reduce stress for 30% in just a single connection, that tells us that it works. So we need to be doing more of it. And we also need to be able to refer to other programs and other agencies that are on the ground, that are with young people every day, so that work can continue.
Amazing. Thank you for both of your responses to that. We have a couple questions in the chat, actually. I'm going to start with one from Jordan. This is for Tracy. I'm just curious if there's been anything to improve graduation rates among Black students, knowing post-secondary is needed, how students are navigating that during a pandemic.
Challenging times. And thank you for data. I love numbers. I didn't really enjoy statistics, but you have to take it because you have to prove what it is you're talking about. So bear through that. So there is a gap in Black student achievement. In fact, the research showed with your OEN number, your Ontario Educational Number, that they can track if you go to college or you go to university or you go to nothing. And disproportionately, the research on looking at that data, Toronto particularly, because they've done it for so long, is that Black students graduate to nothing. We don't know. They're not going to college, they're not going to university. Disproportionately, they're graduating and at home, thinking about their life, hoping to get employment. So that's where those targeted efforts at employment opportunities, targeted efforts for them to graduate. And now we're celebrating the fact that streaming's not allowed anymore. My son's in grade 8 right now, and you cannot say, it looks like you need to go through the applied route. Based on what? Who he looks like, what you feel about him. Even if you were going to look at EQAO data, like grade 3, grade 6, and then grade, but just to randomly decide to stream children immediately from their entry into high school. So streaming is not allowed. Minister Lecce said, not allowed anymore. Allow a little 13-year-old to figure themselves out, and you cannot stream them into a certain pathway already. But it doesn't stop the suggestion every semester. Maybe you should take applied. It's so much easier. Maybe you shouldn't take academic. It's a complex problem that needs to be grabbed from a number of different places, also making post-secondary a more inviting place. And or if we're first generation, as I was, just finding supports and a network on when I get here, that I don't just lose my mind because I don't know where I am or who to look to or who to support. So I'm definitely interested in mentoring young people who can try to navigate through post-secondary. I've said a lot. Ask me the question again, what are we doing to improve graduation rates?
Yeah, if there's anything being done to improve graduation rates among Black students.
We should look to Toronto all the time. Because they did the race-based data, there were student success coaches hired. So they're now, either social workers, CYWs, who are in the Toronto District School Board in schools where the graduation rate is lower. And their target is to improve graduation rates, to work individually with those students, to look at, is it that they're working and going to school? Do they have family barriers to go to finishing school? And so to mitigate those barriers so that they can plan properly. And we have to go farther back. We can't just say, grade 11, you want to go to university. That has to be a plan from grade 6 in your mindset, in the way that you're planning your life, that you are looking towards graduating and, what else there is for you.
Just to add to that, Tracy, do you think that there's an additional impact as a result of the pandemic and remote schooling? And like, is there a way that this might or might not be disproportionately impacting Black students beyond the ways that you've already talked about, given that their communities are harder hit, but like that is there a way that remote schooling is making
yeah,
possible? Yeah.
It could have a combination of effects. It could be increasing the gap if you don't have access to broadband Wi-Fi, if your school board doesn't provide a device. In Durham, every student gets a Chromebook, but what if you don't have? I know of a young girl in a school district where she didn't get a computer, and she was sort of fighting with her mom with a computer, and or trying to do her English credit on her phone, which is near to impossible. But then there are some children who, with the support of their parents, if their parents are very involved, they can be making sure that they get their work done. And there could be a lot more involvement from really supportive parents who could be helping to resolve that. So I think children who are behind may be more disengaged. So it might be just increasing the gap that's there. So it still remains to be seen. I know there are a lot of initiatives in the Black community to educate parents, to teach them to navigate, to really advocate. So strange times for sure.
Thanks, Tracy.
Thank you. And just to add to that, I know that some of those initiatives in the Black community to like support families and like the children and their families navigate the pandemic with regards to school, there's a lot of use of like drop-ins via Instagram lives and like Zoom meetings for those who like do have access to laptops and broadband Wi-Fi, and they can drop into those centers and get that additional support. But like you mentioned, not everybody gets a Chromebook or has that access to the Wi-Fi or has a good computer that they can use. So those are just like additional barriers that they face as well. So the next question is actually for both of you. So this is from Sammy. I'm wondering if both of you can speak to what your organizations are doing to practice decolonization and reconciliation as you serve Indigenous youth. Not sure who would like to go first. Andréanne?
Sure. Of course. I want, initially I want to say a lot, but not enough. Part of my presentation, and I realized that I went very briefly over it, was our Indigenous Action Plan. It is work that we began, I believe, 4 years ago, where we made a commitment of saying we want to commit to decolonization and reconciliation. And how do we do that? Finding Hope is on our website, and it provides all the different actions that we are taking to be looking at ourselves and looking at our processes to make sure that we are providing equal access employment to Indigenous young people, social workers, etc. And how do we make sure that the way that we are doing things is not a barrier, all the way down to our postings, etc. So we are working with Indigenous-led resources and communities to inform the work that we are doing. We are taking those steps based on their recommendations around how does Kids Help Phone become an employer who is diverse and who lifts those barriers of employment. And we're actually also actively seeking employees of diverse backgrounds, because we do feel like there is such great depth that we gain when we are being inclusive and we are looking at our own diversity. From a service lens, it is the same thing. So we're applying the same principles around our Indigenous Action Plan. For example, we are just launching on February 17th our Brighter Days program, which allows us to have in-school programs in Indigenous communities that are led by Indigenous people. We are developing websites and resources in Indigenous languages to make sure that we're not connecting with Indigenous young people and then assuming that they will then go into our French and English website. So it's about increasing the diversity in the ways that we are providing support to make sure that it is delivered by Indigenous people to Indigenous people. We're also doing things as not as simple, but as precise as we're building partnerships. And the first one is with Saskatchewan, where we engaged with communities to know, to ask them, if a young person is in crisis, what are the best resources within your communities in which we could be connecting the young person to? Because we know that there is a disproportionate amount of young people that get entangled with the police when they are Indigenous or young people of color. And so we approach the communities and we're trialing a way in which, if we have an Indigenous young person who's in crisis, who are in those communities, how do we make sure that we provide them the opportunity of connecting them with culturally relevant services that are available to them, and not using sort of the mainstream, well, we should be calling the police because they need immediate support. So we're looking at a holistic approach of providing services, but also challenging the ways in which we would typically do mainstream emergency referrals, because that approach does not work for everyone. And we know that it's inequitable. And how do we do that from our standpoint is also questions that we're asking ourselves, but we are also committed to developing over time.
Yes, as it relates to decolonization in the Indigenous community, I know I work in a complex system, because there is the hierarchy of education, and it is very hierarchical. And then there's the mental health services that I deliver as a school social worker. So in my secondment to School Mental Health Ontario, there was a recent posting for an Indigenous what was it called? It was called Indigenous Cultural Practices Lead. So there's a realization that we have to hire professionals who come from that lived experience, who can then inform the interventions and the practice. It feels like it's just the beginning. And so then hopefully, as the entity who is directing or giving strategies on implementation of mental health services, that we will be able to inform schools and those who design mental health services in schools to be more responsive to Indigenous communities, and to acknowledge the need for decolonization of education, which the whole premise of education was about colonizing the mind. I'm also the chair of the Ontario Association School Social Work Advisory Group. So under the OASW, there are subcommittees, and there's a subcommittee that has been around for, I think, over 30 years about school social work, so advocating for the needs of school social workers, the voice of school social workers, and I'm currently the chair. I just started in September, and our symposium this year was about anti-Black racism. And so we are embedding in our terms of reference the fact that school social workers should be working to dismantle the colonial ideals of education and to move forward on supporting, and restoring the multi-generational trauma that Indigenous families have experienced. So in that effort, we just recruited 2 school social workers who are of Indigenous background. This is hot off the press. And so they'll be coming to our February meeting, but I had a wonderful conversation with a social worker from Simcoe County who's of Indigenous heritage. And she said, Tracy, all this evidence-based approach treatment, and I know I'm speaking at the university, but she's like, sometimes I take students for a walk and we go in touch with nature. And she just shared about her personal experience in terms of how she realized there were certain things that made sense to her, but not until she did practice Indigenous ways of healing and understanding herself and her family's journey did she say, oh, that's why I've always felt this way. That's why this makes sense to me. And it is not a pen and paper assessment, nor is it, a sort of, didactic cognitive behavior therapy. So I'm not sure. We have so much work to do to understand those different ways of healing, validate them, and bring them into these institutions so that we can help students, Indigenous students, in the way that they best need to be healed. I don't know if I brought more questions to your answer.
That was great, Tracy. Thank you. Thanks to both of you. So I'm gonna, I think we're probably just gonna have time for one more question. And this is from our colleague, Dr. Elagia. And I'll just sort of embellish this a bit. But, sort of thinking about the ways that social work services in schools have been kind of eroded over the years. And I would say sort of the erosion of general mental health services and supports in the community, not just in schools. How, and you've talked about this a bit because I think that there's been a big push around this, so it would be good to hear about it. But how are schools and the work that you're doing going to kind of meet some of those increased needs brought on by both of these pandemics? How are you doing that? What is that work looking like? And that's for you, Tracy.
Oh, okay. I was going to let Andréanne go first. I am thrilled because I don't know you guys have been following the memorandums, but both federal and provincial governments have been giving money to mental health. So there's 12.5 million from the federal government in December, and then another 20 million from the provincial government. And School Mental Health Ontario, we get the memo hot off the press. We're always interacting with the ministry and the Ministry of Wellbeing. And so immediately some of the immediate things, Dr. Elagia, is that there's let's hire more mental health staff. It's not social work, although I'm saying social work. Yeah, I'm among social workers, right? That's okay, I'm cool. Because they say mental health practitioners, which could be psychologists, but we understand people in their systems, in their environments. We're the ones, and so that's my stance. That's what I want the OASW to emphasize: hire more social workers, because we understand, individuals in their context and in that longevity of life and what it is that the environment and the community and society has done to them. And so again, there's just a realization with the pandemic, everyone's struggling. Where's the mental health services? Why does it take a year for a child to see a psychiatrist? How can there be a wait list of 18 months for someone to see a clinician? Are you kidding? So we just keep calling the kids help phone until then for repeated 45-minute individual sessions. Then there's a realization that as a person with a marginalized lived experience, you need to speak to someone who understands that. If I spend all my clinical time explaining to you why it is that I am experiencing trauma, then that's not helping me. That's helping you understand me. So we can hire more racialized clinicians and value their expertise and their understanding. So I'm with you, Dr. Elijah, I was saying that right? Because we need to train more and emphasize hiring more social workers and diverse social workers to be able to meet this need, because it is a crisis. But you know, nothing ever changes until there's a crisis. So here's our crisis. We need to pay attention to mental health. Does that answer your question?
Yeah, it does. You can call me Ramona, by the way.
I was being overly formal.
Yeah, no, that's
Okay, Ramona.
Okay. Lovely, but yeah, and I've just been in this for so long, and I did see those memorandums, but they're replacing money that's been lost and eroded over the last 5 years. We need a top up, and this is actually a good way to also convert to more representative social workers in the board. So that's the great thing. But how can we advocate for more? Because the need is greater. They've just, you know, topped up what was lost before in regular times. In COVID and the dual pandemic with racism, we need even more. But, you know, it sounds like there's a great start ahead. And for both of you, I just wanted to say really great presentations. Thank you.
Yes, thank you. I'm wondering, Krista, any thoughts in the next couple of minutes?
I do have one just for the students that are still on the call, because I mean, you presented things that you talked about, things that like we've had conversations about, like as like future practitioners. But I think you know, just given kind of like the times that we're in, one of the main themes that keeps coming up is like, what is going to happen when we all sort of like actually get into the field, and when we leave this sort of Zoom world of just translating theory into practice, like what is going to happen when we actually start doing that. So I think for those of us who are graduating soon, what might be like one piece of advice or something that you think we should consider to help us best support children and families in this like new digital service delivery sort of world? And I recognize giving one thing might just be kind of ridiculous, but anything that you can tell the future practitioners on this call.
It's a very good question, and it's hard to answer with just one thing. I would say to keep learning. This is the end of your official education, but it's just the beginning of actually learning from the young people themselves. And they have very powerful stories giving the opportunity to tell them. And I think that is how we learn what we need to do next, and to make sure that we're able to apply it in a way that feels relevant for them. Because it's always at the end of the day, if it meets their needs, and not so much are we applying what we think we should be doing versus what the young person needs. And really embracing that holistic approach to what healing looks like. Because what we think a young person may need may just not be what they want, and maybe a simple walk will do such a difference to them. And it wasn't necessarily something that we had thought, you know, would be most impactful. So to keep learning, to keep being curious, and to find hopefully a place of practice where you feel that there is connection with your values and your passion. And I think that is where we all strive when we are able to connect with the mission that we're furthering.
Beautiful, thank you. Tracy, do you have one thing to share?
Well, I'll ditto what Andréanne said, and also just, I can be Pollyanna, I can be optimistic. Maybe this virtual platform has caused us to pivot And so I quickly took the seminars on how to, set up a room and leave distractions, and make sure you have good audio and be engaged and be in the camera. So all of that is very important, but maybe it's made it more accessible because now, well, okay, as long as you have the technology, but I did counseling over the phone on a little tiny phone with a girl in her bedroom, and she painted with me. Like, that maybe it's made it more accessible because now I can choose a counselor. And if I want a counselor who looks like me and they only live in Mississauga and I live in the East End, I can still access them every Thursday. Maybe we can get more telepsychiatry. Maybe we can just be able all to remove those barriers, because when you go for counseling, you have to sit in the office and you have to make the appointment. And if you drive all the way, you wouldn't address your trauma. You'd be like, oh, forget it, I'll just keep going. But I also have a private practice, and I have a number of racialized people who are like, I need to see someone. And now we can quietly just join together in a little Zoom session every week and deal with the trauma from way back and everything that you're facing. So maybe it is going to be changing that. So embrace cyber counseling, engage the cyber platform, the virtual platform, because I don't think it's going to go away.
Okay. So, Bryn, did you have anything you wanted to add before?
No, it's 1:30, and that
Okay.
both of those closing statements were amazing. I can't say anything better. Thank you.
So let me just thank you, Andréanne and Tracey, for taking the time and sharing with us what I can only use Bryn's word earlier, your fascinating presentations and our conversation, and for everything you do to support children and families in our communities. And Bryn and Krista, thank you for moderating. Krista, thank you for always stepping up as a student and sharing with us. I couldn't think of a better combination of speakers and services in the way your organizations reach youth. And I think we're really fortunate to have Kids Help Phone in Canada, and that schools we see are not only the ideal place to reach students with mental health needs, but to really foster wellness and prevention, and the way your organizations have pivoted. And thank you to the students who've joined us and will be going out, and for your passion and commitment to the field of children and families. I want to remind everyone that we have recorded this and we'll be posting it. So please let your class colleagues know, faculty, let your students know in your classrooms, because this was too fabulous for others not to see it. Thank you for letting us record it and for sharing it. And everyone, be well, take care of each other.